Welcome back, Dr. Laval.
It's great to be back.
You know, we've talked about a number of things. We've talked about how you were motivated to do what became your passion, how your passion grew to the point that you have a clinic now. But you mentioned you've written a number of books along the way. I've read a number of them. We've reported on a number of them in Total Health. I'd like to start with Cracking the Metabolic Code and ask you if you would give us an outline of that, and then a little later we'd like to talk about some of the specifics that you address in the book.
Oh, great. That's great. Well, you know, Cracking the Metabolic Code was really a synthesis of being in practice for 20 years. You know, one of the things that I do when I have patients come into our facility is we try to teach them that, you know, your health that you have today isn't there by some surprise. That really your metabolism has driven you to the health you have today and where you're going to be tomorrow. And the better we can assess where your chemistry is today and understand risk factors and understand what your body's expressing and what your chemistry is doing to you, the better we can understand how we can change that and get you back on a road towards health and a road towards rejuvenation and not go down that road of increased risk. So Cracking the Metabolic Code is really about redefining metabolism, not just about how many calories you eat and how much you're exercising, because everybody hears metabolism and they think, oh, it's, you know, how much do I weigh? Well, I'm skinny. I don't need to worry about my metabolism. Well, guess what? Skinny people get sick. Overweight people get sick. And the issue is that their chemistry begins to shift as they're aging, and the influences of their genetics, diet, exercise, their stress load, what they're being exposed to in their environment. You know, all these different forces are coming in on your chemistry that you've been influenced over your life. How many drugs that you've been on in your lifetime? Were you a child that was on rampant amounts of antibiotics? Mm-hmm. All of these things play out to create who you are today. So by assessing that and getting a feel for where am I now, then you can start to begin to understand, well, what do I need to do to fix it? Because, you know, there's not a one-size-fit-all equation here for us. You know, it would be great. We've tried that. That doesn't work. You know, we need to begin to understand a more individualized approach of, well, what's affecting me? And so that's why I wrote, you know, Cracking the Metabolic Code and tried to explain how all these different systems of the body come together to end up stimulating things like chronic inflammation, chronic oxidative stress, plaque formation, memory loss, sleep disturbances. Why am I craving foods out of control? I can't seem to get an understanding of how I got all this going on in me, but yet I don't know where to start.
We'd like to come back and talk about some of those conditions individually. I just have one comment I'd like to ask you to react to. You said skinny. Today, skinny is supposedly measured by your body mass index. However, I understand that you can be clinically obese and still be skinny depending on where that weight is. Is that correct?
Oh, sure. I mean, body mass index is a decent tool. You know, what we do, we use infrared body fat analysis. So we have a biceptal infrared machine that we beam in, and we get an accurate reading on BMI. Where, of course, it gets skewed. I mean, for example, I'm a weightlifter, so I mean, I've trained a lot over the years, and you know, clinically, I'm obese. My body mass index is high, but I have very low body fat. So there is that skewing for people that have that are either very fit and maybe over on their BMI, or you could have people that are within normal body mass index, but they could have a high percentage of body fat.
Right around the middle, right?
Right around the middle, and that's the dangerous fat. That fat that's right around the middle, or what's called visceral fat or belly fat, people don't realize it's not just hanging around. It's actually secreting hormones and chemicals and all types of signaling compounds that are leading you towards Alzheimer's, heart disease, cancer, diabetes, neurologic disorders. All these things are coming out now, that there's a correlation to that waist circumference, how much belly fat, and then what's going to happen with your future health.
So you'd suggest next time someone gets on the scale, then they go over to the mirror and try to figure out where all that weight is, right?
That's exactly right.
Thanks very much. We'll talk to you later. Bye.